of Speech and Hearing, where in today's program we aim to provide you with expert guidance and valuable insights on the tinnitus related queries. This program is organized as a part of Tinnitus Awareness Week, which is celebrated from 3rd February to 9th February. The All India Institute of Speech and Hearing is a premier institute dedicated to the study, research, and treatment of speech and hearing disorders. Established in 1965, AIISH has gained national and international recognition as a leading institution in the field of communication sciences and disorders, offering a diverse range of undergraduate and postgraduate programs in speech language pathology, audiology, and special education. AIISH plays a crucial role in training professionals and advancing research in communication disorders. With state of the art facilities, experienced faculty, and a commitment to excellence, the Institute stands at the forefront of education, clinical services, and innovation. Today, we are privileged to have with us distinguished resource speaker who brings a wealth of expertise to our discussion. I welcome Dr. Prashant Prabhu, who works as Assistant Professor in the Department of Audiology. Welcome to you, sir. Myself, Adeline D'Souza, working as audiologist in the Department of Audiology, will moderate this program. Audience, please note, as this program is being live streamed, you can call us by dialing 0821 250 2530, or you can type your queries in the comment section in the AIISH Mysore YouTube or Facebook page where this program is being live streamed. So, as we dive into today's discussion, I'd like to start with the condition that many people experience but might not fully understand. It's something that can be mere nuisance for some, whereas life-altering challenge for many. Many report it as a persistent ringing, hissing, or buzzing sound in their ears. So, sir, could you please elaborate on what exactly tinnitus is, what causes this mysterious sound in our ears, and how does it affect to those who experience it?
So thank you, Adeline, and thank you for people who have joined this discussion. So as Adeline said, so every year, the first week of February is considered to be a Tinnitus Awareness Week. So as a part of Tinnitus Awareness Week commemoration, so we are here with a live-in program on tinnitus. So tinnitus is something like hearing a ringing sound or a hissing sound or a buzzing sound in the ears. Okay, so without any external stimulus, if a person is hearing such sounds in the ears, that's what is referred to as tinnitus. So all of us would have heard tinnitus some or the other time. So all of us would have heard some 𝐀𝐰𝐚𝐫𝐞𝐬 kind of a sound in our ears. But that lasts for like few seconds, and after that it will go off on its own. But there are some people who hear it continuously throughout the day, that is always there, and because of that what happens is it starts to affect their quality of life. Because of that they start to suffer because of the tinnitus. Imagine they are trying to study, so they are not able to concentrate because there is a continuous 𝐀𝐰 sound that they are hearing. Or the person might have difficulty sleeping. He's trying to go to sleep, but there is a constant ringing sound in the ears, which doesn't allow him to go to sleep. So we use a term for that called as tinnitus disorder. So if the sound becomes bothersome to the patient and it starts to affect the quality of life of an individual, then we call it as a tinnitus disorder. So there are several individuals who are suffering because of this condition. I mean, if you look into the statistics, almost 15% of the world population is actually suffering from tinnitus. It is not an uncommon condition. It is very common, and many of us, many people are suffering because of it. Okay? So because of that, this awareness week is mainly to help people to know more about tinnitus, because a constant thing that we hear is saying that there is no cure for tinnitus. Tinnitus has to be present lifetime and all that, but there are management options available, and there are cure that is available for individuals who are suffering from tinnitus. So since you asked about what causes tinnitus, I mean, why does a person hear tinnitus. So let's look into what is the reason for generation of tinnitus. So that's always a question that a patient will have in their mind. So why am I hearing this sound? So what causes it? So if we understand that, so then the treatment becomes much more easier. So to make the audience understand, there are three parts in our ear. So they have something called as an outer ear, middle ear, and inner ear. So what happens is, if there is any problem in the outer ear, middle ear, or in the inner ear, so that the sound is not properly reaching the brain, what does our auditory system do is, I'm not able to hear the sounds, so the brain tries to produce the sounds it is not hearing. So that's how the tinnitus starts to get generated. So for example, if I have wax in my ears, so the sound does not pass properly and reach the brain because there is some hearing loss that is present. So what does the brain do? So brain will try to help you hear the sounds that you are not able to hear. Okay, so what happens is, so that is like a mechanism, or a sound that you are hearing is to help you hear the sounds which you do not are not perceiving. So what actually happens is, like if you remove the wax, so then the normal hearing restores and the tinnitus will automatically go off. On similar lines, so any disorder, I mean anything which causes a hearing loss to the patient, okay, so that leads to tinnitus. So that is one of the causes. So there are several causes of hearing loss. So maybe because of aging the person gets hearing loss, or because of noise exposure the person gets hearing loss. So one of the reason for getting tinnitus is, if I have a hearing loss, the brain tries to compensate for it by producing the extra sound that you are hearing. So majority of the individuals who have hearing loss, so they tend to suffer because of the tinnitus, and that is one of the major reasons. So that actually causes the tinnitus. There are other reasons as well. So one of the common reason, or the major reason for generation of tinnitus, is because of a hearing loss that is there in your outer ear, middle ear, or in the inner ear, and because of that, brain tries to help you to hear the sound that you are not hearing, and that's how you perceive the sound to be tinnitus.
So this tinnitus, as majority if they experience, how bothersome can it be? Like, would it affect other aspects of their life, like psychological aspects? How would it impact to the person experiencing it?
Yeah, so that's an important question. So because the individuals who are suffering from tinnitus, so they actually know how irritating the sound can be, and how it can affect their psychological well-being together. So one of the reason is, like, there are people who are hearing tinnitus, but the people tend to suffer because of the tinnitus, because they'll have some psychological association to it. So for example, if I am hearing a tinnitus, what will I do is, I'll start to think, why am I hearing the tinnitus, and a lot of negative emotions starts to come in. So because of that, what happens, there are additional areas in the brain that starts to get activated. So due to which there would be extra connections which makes the tinnitus even more louder. So not everybody with hearing loss suffers from tinnitus, but there are some individuals who suffer from tinnitus. Why? Because we tend to pay more attention to it. We tend to start worrying about it. So people, what do is they start to think, maybe I'm hearing a sound, so that will make my hearing go worse. So maybe I will stop hearing, so I will have to wear hearing aid all the time. Or they would Google it and they would say that there can be some condition that can lead to tinnitus. They start to worry about it. So is it their lifetime? So all these negative thinking that comes in will make the tinnitus even more worse. So the point that I want to convey is, I told you in the beginning that tinnitus is not a dangerous sound. So once the mind realizes that it is not dangerous, so they stop paying that negative attention to it. So they stop providing that negative attention and negative emotion. So because of that, so the psychologically they start to become much more stronger, and that helps a person overcome the tinnitus. So there are people with absolutely normal hearing. They also start to suffer from tinnitus. So why does that happen is, because they would have heard tinnitus some or the other time, and because of maybe they have gone to a concert and there is a loud sound because of which the tinnitus started and all that, and they start to worry about it, they start to think about it. So this goes like a cycle. So because of the sound, they start to worry. Even if the hearing has improved, because of the negative thinking or the psychological association, the tinnitus continues to be heard. So because of this reason, many normal hearing people, or even after their hearing is cured with hearing aids or with medical management, they still continue to hear the tinnitus. And that is because of the psychological overlay or the psychological impact that they are having because of the tinnitus.
There is also a myth that we would have heard that tinnitus is often associated with aging. And many people believe it is a condition that mostly affects only older adults. But in today's world, we have heard that due to increased exposure to loud noise or excessive use of earphones and excessive noise in the urban areas, we have seen that even younger people develop tinnitus. So, is tinnitus primarily that age-related condition, or can it affect even the younger adults or any age group?
Yeah, so tinnitus can affect any age group, starting from children till geriatric population as well. Okay, so initially it was only geriatric population who used to report with complaint of tinnitus. As you clearly pointed out, so nowadays even the younger generation is coming up with complaints of tinnitus. So the main reason for that is the noise-induced hearing loss, that is, they are exposed to loud noise always. Another thing that happens is also, we call it as music-induced hearing loss. So now all of us see that they always have a earpod in them, and they constantly are hearing to loud music. So that music can cause hearing loss, and the side effect of the hearing loss would be tinnitus. They start to hear tinnitus. And another thing that has also happened because of the lifestyle changes is also the stress. So because of maybe there is a lot of work pressure and all that, so what happens is that also can trigger tinnitus. And we see that many IT professionals come with tinnitus because they work at night where there is absolute silence, and because of the stress and all that, so the sound becomes even more louder and they start to worry because of it. And tinnitus has also been seen more even in children as well. So because now even we see children playing with PlayStations with loud music and all that, they are also getting exposed to loud sound. So if you look at the prevalence of tinnitus even in children is also more. So because of that, so tinnitus can affect any age group, starting from children and adults or from geriatric. So it is important that we take appropriate measures to prevent hearing loss as much as possible. Once the hearing loss is prevented, so that is a cure for tinnitus. I mean, tinnitus does not occur. So it's important that we hear it at safe volume. Music that you are hearing is always at a safe volume level and all that. So once we do it, so then the occurrence of tinnitus becomes lesser.
So many people who experience tinnitus usually wonder whether it can actually affect their ability to hear in case if they have normal hearing. And since tinnitus is commonly described as ringing, buzzing or hissing kind of sound in their ears, some worry that it might interfere with their ability to understand speech or hear normally. So could you explain the relationship between tinnitus and hearing? Is it always associated with hearing loss? How does it occur?
So here, tinnitus can be associated with hearing loss, and tinnitus need not be associated with hearing loss. There are two aspects. So first thing is, if a person has hearing loss, as a condition that co-occurs with hearing loss, the person will experience tinnitus. Okay, and there are another group of people with absolutely normal hearing without any issues at all. So they also can get hearing loss. So the reason that I explained is because of the negative associations that they connect with. So because of that, what happens is they are hearing the sound, but 90% of us would automatically ignore it. I mean, we won't pay much attention to the tinnitus sound. So, but there are some 10% of individuals who start to worry or start to get bothered because of the tinnitus. So that starts to make the tinnitus even more louder. So, and even they don't have any hearing loss as such, but the common thing, mistake that they may think that, okay, because of the sound, I might get hearing loss. So that is not true, because the sound does not cause any damage to the body. I mean, the tinnitus sound is not something which can cause any further hearing loss. It does not cause any ear-related issues at all. So all of that is, something that we cannot, explain, or that is not related at all. So the way that we react to tinnitus is something that will cause it.
Hello. Hello.
ಹಲೋ,
Yes, ma'am.
ಇದು ಅಖಿಲ ಭಾರತ ವಾಕ್ಶ್ರವಣ ಸಂಸ್ಥೆ.
ಹೌದು, ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಕೇಳ್ತೀರಾ?
ನಮ್ಮ ಪ್ರಶ್ನೆ ಬಂದು ನಮ್ಮ ಅಜ್ಜಿಗೆ ಸ್ವಲ್ಪ ಕಿವಿ ಗುಯಿ ಅಂತ ಇದೆ. ಸೊ ನಿಮ್ಮ ಸಂಸ್ಥೆಗೆ ಕರ್ಕೊಂಬಂದು ಟೆಸ್ಟ್ ಮಾಡಿಸಿ ಮೆಷಿನ್ ಹಾಕ್ಸಿದೀವಿ.
ಓಕೆ.
ಆದರೂ ಅದು ಕಮ್ಮಿ ಆಗ್ತಿಲ್ಲ. ಸೊ ಏನು ಮಾಡೋದು ಅಂತ ಏನಾದರೂ ಸಜೆಷನ್?
ಓಕೆ.
ಓಕೆ, ಸೊ ಯಾವಾಗಿಂದ ಅವ್ರಿಗೆ ಈ ಥರ ತೊಂದರೆ ಇದೆ?
ಹಲೋ,
ಯಾವಾಗಿಂದ ಅವ್ರಿಗೆ ಈ ಥರ ಸಮಸ್ಯೆ ಇರೋದು?
ಸರ್ ಒಂದು 5 ಇಯರ್ಸಿಂದ ಇದೆ ಸರ್.
ಓಕೆ, ಸೊ ನೀವು ಮೆಷಿನ್ ಹಾಕ್ಸಿ ಎಷ್ಟು ದಿನ ಆಯಿತು?
ಮೆಷಿನ್ ಹಾಕ್ಸಿ 2 ಇಯರ್ಸ್ ಆಯಿತು.
2 ಇಯರ್ಸ್ ಆಯಿತು. ಸೊ ಎರಡೂ ಕಡೆ ಶಬ್ದ ಬರುತ್ತಾ ಅಥವಾ ಒಂದು ಕಡೆ ಮಾತ್ರ ಬರುತ್ತಾ?
ಅವ್ರಿಗೆ 2 ಕಡೆ ಬರುತ್ತೆ. ಆ್ಯಂಡ್ ಸ್ವಲ್ಪ ನಿದ್ದೆನೂ ಅಷ್ಟು ನೀಟಾಗಿ ಮಾಡಲ್ಲ. ನೈಟ್ ಲೇಟಾಗಿ ಮಲಗ್ತಾರೆ ಸ್ವಲ್ಪ ಆ ಶಬ್ದ ಇರೋದಕ್ಕೆ.
ಓಕೆ, ಸೊ ಹಿಯರಿಂಗ್ ಏಡ್ ಎರಡೂ ಕಡೆ ಯೂಸ್ ಮಾಡ್ತಿದ್ದಾರಾ?
ಹೌದು ಹೌದು ಸರ್, 2 ಕಡೆ ಮಾಡ್ತಾ ಇದ್ದಾರೆ.
ಓಕೆ, ಸೊ ಈ ಥರ ಅವ್ರಿಗೆ ಏಜ್ ರಿಲೇಟೆಡ್ ಹಿಯರಿಂಗ್ ಲಾಸ್ ಇರೋದ್ರಿಂದ ಅವ್ರಿಗೆ ನಾನು ಆಗಲೇ ಹೇಳಿದಾಗೆ ಅವ್ರಿಗೆ ಕಿವಿಯಲ್ಲಿ ಗುಯಿ ಅಂತ ಶಬ್ದನೂ ಬರ್ತಾ ಇರುತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ಸೊಲ್ಯೂಷನ್ ಏನು ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ಫಸ್ಟ್ ಅವ್ರಿಗೆ ಯಾಕೆ ಬರ್ತಾ ಇದೆ ಅನ್ನೋದನ್ನು ತಿಳಿಸ್ಕೊಡ್ಬೇಕು. ಒಂದು, ಅವರು ಕೇಳಿಸ್ಕೊಳ್ಳೋ ಶಕ್ತಿ ಕಡಿಮೆ ಇರೋದ್ರಿಂದ ಬ್ರೈನ್ ಅದನ್ನು ಅದನ್ನೇ ಹೆಲ್ಪ್ ಮಾಡೋಕ್ಕೋಸ್ಕರ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ತಾ ಇದೆ. ಅದು ಒಂದು ಮೊದಲನೇ ವಿಷಯ. ಎರಡನೇದು ಏನಂತ ಹೇಳಿದ್ರೆ ಅವರು ಅದ್ರ ಬಗ್ಗೆ ಜಾಸ್ತಿ ಯೋಚನೆ ಮಾಡ್ತಾ ಇರ್ಬೋದು. ಅಯ್ಯೋ ಇದು ನಿಲ್ತಾನೆ ಇಲ್ವಲ್ಲ ಅಂತ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಆತಂಕ ಪಟ್ಕೊಳ್ಳೋದು, ಆ ಥರದ್ದೆಲ್ಲನೂ ಮಾಡ್ತಾ ಇರೋದ್ರಿಂದನೂ ಅದು ಜಾಸ್ತಿ ಆಗ್ತಿರುತ್ತೆ. ಸೊ ಅದನ್ನು ಫಸ್ಟ್ ಅವ್ರಿಗೆ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ ಹೇಳಬೇಕು. ಅಂದರೆ ಲಾಸ್ ಇರೋದ್ರಿಂದ ಬರ್ತಾ ಇರೋಂಥದ್ದು, ಅದರಿಂದ ಏನೂ ತೊಂದರೆ ಆಗಲಿಕ್ಕಿಲ್ಲ ನಿಮ್ಮ ಬಾಡಿಗೆ ಅನ್ನೋದನ್ನು ನೀವು ಕ್ಲಿಯರಾಗಿ ಹೇಳಬೇಕಾಗತ್ತೆ. ಅದ್ರ ಜೊತೆ ಈಗ ನಾವು ಹಿಯರಿಂಗ್ ಏಡಲ್ಲಿ ಪ್ರೋಗ್ರಾಮ್ ಮಾಡಬೇಕಾದ್ರೆ ಹಿಯರಿಂಗ್ ಏಡಲ್ಲಿ ಒಂದು ಮಾಸ್ಕರ್ ಅನ್ನೋ ಒಂದು ಆಪ್ಷನ್ ಬರುತ್ತೆ. ಅಂದರೆ ಹಿಯರಿಂಗ್ ಟಿನೈಟಸ್ ಮಾಸ್ಕರ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ಟಿನೈಟಸ್ ಮಾಸ್ಕರ್ಸ್ ಅಂತ ಹೇಳಿದ್ರೆ ಆ ಗುಂಯನ್ನು ಬರ್ತಾ ಇರ್ತಕ್ಕಂಥ ಶಬ್ದವನ್ನು ಅದು ಮಾಸ್ಕ್ ಮಾಡುತ್ತೆ ಅಂದರೆ ಅದನ್ನು ಸ್ವಲ್ಪ ಕಡಿಮೆ ಕೇಳೋ ಹಾಗೆ ಮಾಡುತ್ತೆ. ಸೊ ಅದನ್ನು ಆ ಫೀಚರ್ ಆ ಹಿಯರಿಂಗ್ ಏಡಲ್ಲಿ ಇದ್ದರೆ ಅದನ್ನು ನಾವು ಆ್ಯಕ್ಟಿವೇಟ್ ಮಾಡಿ ಕೊಡ್ಬೋದು. ಸೊ ಇಲ್ಲಿಗೆ ಬಂದರೆ ಅದನ್ನು ಆ್ಯಕ್ಟಿವೇಟ್ ಮಾಡಿ ಅದರಿಂದ ಮಾಸ್ಕ್ ಮಾಡೋ ಹಾಗೆ ಮಾಡ್ಬೋದು. ಅದಿಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೂ ಸಹ ಅವ್ರಿಗೆ ಹೊರಗಡೆಯಿಂದ ಆವಾಗ ಒಂದು ಸ್ಪೀಕರ್ ಮುಖಾಂತರ ಅವ್ರಿಗೆ ಇಷ್ಟವಾಗಂಥ ಯಾವ್ದಾದ್ರು ಒಂದು ಶಬ್ದವನ್ನು ಅವರು ಕೇಳೋ ಮುಖಾಂತರ ಏನಾಗುತ್ತೆ ಆ ಶಬ್ದವನ್ನು ಕಡಿಮೆ ಮಾಡ್ಕೊಳ್ಳೋದನ್ನು ನಾವು ತಿಳಿಸ್ಕೊಡ್ಬೋದು. ಸೊ ಅದಕ್ಕೆ ನೀವು ಅವ್ರನ್ನ ಪುನಃ ನಮ್ಮ ಸಂಸ್ಥೆ ಕರ್ಕೊಂಡ್ಬಂದರೆ ಅವ್ರಿಗೆ ಇದನ್ನು ಹೇಗೆ ಆ ರೀತಿ ಹಿಯರಿಂಗ್ ಏಡಲ್ಲಿ ಅಡ್ಜಸ್ಟ್ ಮಾಡ್ಕೊಳ್ಳೋಂಥದ್ದು ಅದನ್ನು ನಾವು ತಿಳಿಸ್ತೀವಿ. ಆಮೇಲೆ ಯಾವ ಥರದ ಸೌಂಡ್ಗಳನ್ನು ಅವರು ಬಳಸಬೇಕು ಅನ್ನೋದನ್ನು ನಾವು ತಿಳಿಸ್ತೀವಿ. ಯಾವಾಗ ಈ ಸೌಂಡನ್ನು ಹಾಕಿದಾಗ ಏನಾಗುತ್ತೆ, ಕೇಳ್ತಾ ಇರ್ತಕ್ಕಂಥ ಸೌಂಡು ನಮಗೆ ಅಷ್ಟು ದೊಡ್ಡದಾಗಿ ಅಥವಾ ಅಷ್ಟು ಜಾಸ್ತಿಯಾಗಿ ಕೇಳೋದಿಲ್ಲ. ಸೊ ಈಗ ಅವರು ಮಲಗಬೇಕಾದ್ರೆ ತೊಂದರೆ ಅಂತ ಹೇಳಿದ್ರಿ, ಮಲಗಬೇಕಾದ್ರೆ ಯಾಕೆ ತೊಂದರೆ ಆಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅವರು ಈಗ ಮಲಗೋ ಟೈಮಲ್ಲಿ ಬಹಳಷ್ಟು ಸೈಲೆಂಟ್ ಎನ್ವೈರ್ಮೆಂಟ್ ಇರುತ್ತೆ. ಸೊ ಆದಷ್ಟು ಏನೂ ಸೌಂಡ್ ಇರೋದಿಲ್ಲ. ಸೊ ಅದಕ್ಕೆ ಮಲಗೋಗಿ ಮುಂಚೆ ಏನಾದರೂ ಅವ್ರಿಗೊಂದು ಸೂತಿಂಗ್ ಸೌಂಡ್ ಅಥವಾ ಏನಾದರೂ ಒಂದು ಅವ್ರ ಮನಸ್ಸನ್ನು ಕಾಮ್ ಮಾಡುವಂಥ ಒಂದು ಸೌಂಡನ್ನು ಹಾಕ್ಕೊಂಡು ಅವರು ಮಲಗೋಗಿ ಹೋಗೋದ್ರಿಂದ ಏನಾಗುತ್ತೆ ಅವ್ರಿಗೆ ಕೇಳ್ತಾ ಇರ್ತಕ್ಕಂಥ ಕಿವಿಯಲ್ಲಿ ಬರ್ತಾ ಇರ್ತಕ್ಕಂಥ ಶಬ್ದ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಇದಕ್ಕೊಂದು ಎಕ್ಸಾಂಪಲ್ ಕೊಟ್ಟು ಹೇಳ್ತೀವಿ. ಇಮ್ಯಾಜಿನ್ ಒಂದು ಕತ್ಲೆ ರೂಮಲ್ಲಿ ಒಂದು ಕ್ಯಾಂಡಲ್ ಹಚ್ಚಿದಾಗ ಏನಾಗುತ್ತೆ, ನಮ್ಮ ಸಂಪೂರ್ಣವಾದ ಅಟೆನ್ಷನ್ ಆ ಕ್ಯಾಂಡಲ್ ಮೇಲೆ ಹೋಗುತ್ತೆ. ಬಟ್ ಅದೇ ನಾವೊಂದು ಲೈಟ್ ಹಾಕಿ ಕ್ಯಾಂಡಲ್ ಇದ್ದಾಗ ಏನಾಗುತ್ತೆ, ನಮಗೆ ಕ್ಯಾಂಡಲ್ ಮೇಲೆ ಕೊಡೋಂಥ ಅಟೆನ್ಷನ್ ಕಡಿಮೆ ಆಗುತ್ತೆ ಅಥವಾ ಗಮನ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಅದೇ ರೀತಿ ಅವ್ರು ಮಲಗೋಕ್ಕಿಂತ ಮುಂಚೆ ಅಥವಾ ಯಾವಾಗ ಅವ್ರಿಗೆ ಆ ಶಬ್ದ ತೊಂದರೆ ಕೊಡ್ತಿದ್ಯೋ ಅಂಥ ಸಮಯದಲ್ಲೆಲ್ಲ ಯಾವ್ದಾದ್ರು ಒಂದು ಬ್ಯಾಕ್ಗ್ರೌಂಡ್ ಸೌಂಡ್ ಅವ್ರಿಗೆ ಇಷ್ಟವಾಗುವಂಥ ಸೌಂಡನ್ನ ಹಾಕೋ ಮುಖಾಂತರ ಅಥವಾ ಹಿಯರಿಂಗ್ ಏಡಲ್ಲೇ ಪ್ರೋಗ್ರಾಮ್ ಮಾಡೋ ಮುಖಾಂತರ ನಾವು ಅವ್ರಿಗೆ ಅದನ್ನು ಸೊಲ್ಯೂಷನನ್ನು ಕೊಡ್ಬೋದು. ಸೊ ನೀವು ಪುನಃ ಈ ಸಂಸ್ಥೆಗೆ ಬಂದರೆ ನಾವು ಅದನ್ನು ಈಗ ನಮ್ಮದೇ ಒಂದು ಸೆಂಟರ್ ಆಫ್ ಎಕ್ಸಲೆನ್ಸಲ್ಲಿ ಸೆಂಟರ್ ಫಾರ್ ಪರ್ಸನ್ಸ್ ವಿತ್ ಟಿನೈಟಸ್ ಆ್ಯಂಡ್ ವೆಸ್ಟಿಬ್ಯುಲರ್ ಡಿಸಾರ್ಡರ್ಸ್ ಇದೆ. ಸೊ ಟಿನೈಟಸ್ ತೊಂದರೆ ಇರೋರಿಗೆ ಅಂತಲೇ ಡೆಡಿಕೇಟೆಡ್ ಆಗಿರೋಂಥ ಸೆಂಟರ್. ಅಲ್ಲಿಗೆ ಕರ್ಕೊಂಬಂದರೆ ಅವ್ರನ್ನ ಡೀಟೇಲಾಗಿ ಇನ್ನೊಂದ್ಸಲ ಇವ್ಯಾಲ್ಯೂಯೇಷನ್ ಮಾಡಿ ಅವ್ರಿಗೆ ಏನು ಕೌನ್ಸಿಲಿಂಗ್ ಅವಶ್ಯಕತೆ ಇದೆ ಅದನ್ನು ನೋಡಿ ಹಿಯರಿಂಗ್ ಏಡಲ್ಲಿ ಏನು ಪ್ರೋಗ್ರಾಮಿಂಗ್ ಮಾಡ್ಬೋದು ಅದನ್ನು ನಾವು ಮಾಡಿಕೊಡ್ತೀವಿ ನಿಮಗೆ.
ಓಕೆ ಸರ್, ಅದು ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಲಿಕ್ಕೆ ಏನಾದರೂ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತೊಗೋಬೇಕಾ ಸರ್?
ಅದೇ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತೊಗೊಂಡು ಬಂದರೆ ಒಳ್ಳೆಯದು. ಯಾಕಂದರೆ ಆನ್ಲೈನ್ ಅಪಾಯಿಂಟ್ಮೆಂಟು ಸಹ ತೊಗೋಬೋದು ನೀವು, ಆಪ್ಷನ್ನು ಇದೆ. ಅಥವಾ ನೀವು ಬೆಳಗ್ಗೆ ಬೇಗನೆ ಬಂದು ಅದನ್ನು ವೆಯ್ಟ್ ಮಾಡಿ ಮಾಡ್ಬೋದಾಗುತ್ತೆ. ಇಲ್ಲಾಂದ್ರೆ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತೊಗೊಂಡು ಬಂದರೆ ಅದನ್ನು ಎಷ್ಟು ವರ್ಷ ಆಗಿದೆ ಅದನ್ನು ನೋಡಿಕೊಂಡು ಪುನಃ ರಿವ್ಯಾಲ್ಯೂಯೇಷನ್ ಅವಶ್ಯಕತೆ ಇದ್ದರೆ ಅದನ್ನು ಮಾಡಿ ಅದಕ್ಕೆ ತಕ್ಕಂಗೆ ನೆಕ್ಸ್ಟು ಏನು ನಿಮಗೆ ಪ್ರೋಗ್ರಾಮಿಂಗ್ ಆಗಲಿ ಕೌನ್ಸಿಲಿಂಗ್ ಆಗಲಿ ಏನು ಮಾಡಬೇಕು ಅನ್ನೋದನ್ನು ನಾವು ನಿಮಗೆ ತಿಳಿಸ್ತೇವೆ.
ಓಕೆ ಸರ್, ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಸರ್, ತುಂಬ ಹೆಲ್ಪ್ ಆಯಿತು.
ಧನ್ಯವಾದ.
Sir, also some people wonder if they take medications for some other health condition, would that impact their tinnitus or would that make their symptoms of tinnitus more worse?
So technically, the medications that they are taking should not cause any tinnitus, or it should not really affect the tinnitus. But there are some medications called as which are ototoxic, which are damaging to the ears. If a person takes maybe a strong antibiotic, or a person has other medical conditions because of which the drugs have to be given, as a side effect, what can happen is that the person might start to hear the ringing sound or a tinnitus kind of a sound. So he can start to hear, but the medication that he is actually taking for other conditions should not actually affect it.
Hello? Hello?
ಹಲೋ,
Yes, sir.
ಮೇಡಮ್ ನಮಸ್ತೆ. ರಘು ಅಂತ, ಮೈಸೂರಿಂದ.
ಹೇಳಿ ಸರ್.
ಮೇಡಮ್, ನಿಮ್ದು ರಿಂಗಿಂಗ್ ಸೆನ್ಸೇಷನ್ದು ಲಿಂಕ್ ಕಳಿಸಿದ್ರು ಸುಪ್ರಭಾ ಅಂತ. ಅವ್ರದ್ದು ನಾನು ಲಿಂಕ್ ಓಪನ್ ಮಾಡಿ ಅದು ಪ್ರೋಗ್ರಾಮ್ ನೋಡ್ತಾ ಇದ್ದೆ. ನಂಗೆ ಒಂದು ಕ್ವಶನ್ ಇತ್ತು ಮೇಡಮ್ ಬೆಳಗ್ಗೆ.
ಹಾಗೆ
ಇದು ನಮ್ಮ ತಾಯಿಗೆ 53 ಇಯರ್ಸ್ ಓಲ್ಡ್. ಅವರಿಗೆ ಸುಮಾರು ಒಂದು 10 ವರ್ಷದಿಂದನೂ ಲೆಫ್ಟ್ ಇಯರ್ ಅಲ್ಲಿ ಅವ್ರಿಗೆ ಡುಯಿ ಅನ್ನೋದು ಶಬ್ದ ಕೇಳ್ತಾ ಇತ್ತು ಸರ್. ಸೊ ಅದು ಏನ್ ತುಂಬಾ ಸೀರಿಯಸ್ ಇಶ್ಯೂನ ನಾವೇನಾದ್ರು ತೋರಿಸ್ಕೋಬೇಕಾ, ಇಲ್ಲ ಅದು ಹಂಗೆ ಕಡಿಮೆ ಆಗುತ್ತೆ ಸರ್ ಕ್ರಮೇಣ?
ಸೊ ಇಲ್ಲಿಗೆ ಬಂದು ನೀವು ಟೆಸ್ಟ್ ಮಾಡಿಸಿದ್ರಾ ಅಥವಾ ಹೇಗೆ?
ಸರ್ ನಾನು ಒಂದ್ಸರಿ ಮಾಡ್ತಿದ್ದೆ, ಬಟ್ ಅಲ್ಲಿ ಮಾಡಿಸಾಗ ಎಲ್ಲ ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡ್ತಿದ್ರು.
ಓಕೆ.
ಆಮೇಲೆ ಅವ್ರಿಗೆ ಅದೇನೋ ಸೀರಿಯಸ್ ಅಂತ ಏನು ಅನ್ಸ್ತಾ ಇರ್ಲಿಲ್ಲ. ಸೊ ಆಮೇಲೆ ಫಾಲೋ ಅಪ್ಗೆ ಬರ್ಲಿಲ್ಲ ಸರ್. ಇವಾಗ ಇದ್ರ ಬಗ್ಗೆ ನಾನು ಕೇಳ್ತಿದ್ದಾಗ ಅನಿಸ್ತು ಇನ್ನೊಂದ್ಸಲಿ ಕೇಳೋಣ, ತುಂಬಾ ಸೀರಿಯಸ್ ಅನ್ನೋದ್ರೆ ಒಂದ್ಸಲಿ ತೋರ್ಸೋಣ ಅನ್ಸುತ್ತೆ.
ಅದೇ, ಸೊ ಯೂಶಲಿ ಏನಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅವ್ರಿಗೆ ಕೇಳಿಸ್ಕೊಳಕ್ಕೆ ಏನಾದ್ರು ಸಮಸ್ಯೆ ಇದೆಯಾ ಆ ಕಡೆ ಕಿವಿಯಲ್ಲಿ? ಸ್ವಲ್ಪ ಕಡಿಮೆ ಕೇಳೋದು?
ಅವ್ರಿಗೆ ಕೇಳ್ತದೆ ಇಲ್ಲ, ಅವ್ರಿಗೆ ಆ ಕಡೆ ತುಂಬಾ ಕಡಿಮೆ, ಜೋರ್ ಮಾತಾಡ್ತಾ ಮಾತ್ರ ಕೇಳ್ತದೆ ಅವ್ರಿಗೆ.
ಓಕೆ ಓಕೆ.
ಗುಯ್ ಅನ್ನೋದೇ ಜಾಸ್ತಿ ಅನ್ಸುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ ಸರ್.
ಸೊ ಅದೇನೆ, ಅದು ಆ ಗುಯ್ ಅನ್ನೋ ಶಬ್ದ ಯಾಕೆ ಬರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅವ್ರಿಗೆ ಹಿಯರಿಂಗ್ ಲಾಸ್ ಇರೋ ಕಾರಣದಿಂದ ಆ ಕಿವಿಯಲ್ಲಿ ಅದು ಗುಯ್ ಅಂತ ಶಬ್ದ ಬರುತ್ತೆ. ಸೊ ಅದರಿಂದ ಅವ್ರಿಗೆ ಗುಯ್ ಅನ್ನೋ ರಿಂಗಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಬರ್ತಾ ಇರೋದು. ಬಟ್ ಆ ಕಾರಣದಿಂದ ಇನ್ನೇನು ಮೇಜರ್ ತೊಂದರೆ ಏನು ಇರ್ಲಿಕ್ಕಿಲ್ಲ ಯೂಶಲಿ. ಯಾಕಂದ್ರೆ ಬಿಕಾಸ್ ಹಿಯರಿಂಗ್ ಲಾಸ್ದು ಒಂದು ಲೈಕ್ ಪಾರ್ಟ್ ಆಫ್ ಇಟ್ ಥರನೇ, ಯಾಕಂದರೆ ಕೇಳಿಸ್ತಿಲ್ವಲ್ಲ, ಅದಕ್ಕೋಸ್ಕರ ಅವ್ರಿಗೆ ಏನಾಗುತ್ತೆ ಆ ಸೌಂಡ್ ಬರ್ತಾ ಇರುತ್ತೆ. ಯಾವಾಗ ಆ ಕಡೆ ಕೇಳಿಸೋದನ್ನ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೋ ಅವಾಗ ಏನಾಗುತ್ತೆ ಕ್ರಮೇಣ ಅದು ಕಡಿಮೆ ಆಗಂತ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಆಮೇಲೆ ಅದ್ರ ಬಗ್ಗೆ ಆದಷ್ಟು ಅವರು ಗಮನ ಕೊಡಬಾರ್ದು ಅಂತ ಹೇಳಿದ್ರೆ ಅದ್ರ ಪಾಡ್ಗೆ ಅದು ಇರಲಿ ಅಂತ ಬಿಡಬೇಕು. ಯಾಕಂದರೆ ಅದು ನಮ್ಗೇನಾದರೂ ತೊಂದರೆ ಮಾಡುತ್ತೆ ಅಥವಾ ಒಂದು ಡೇಂಜರ್ ಅಂದರೆ ಮಾತ್ರ ಅದ್ರ ಬಗ್ಗೆ ವರಿ ಮಾಡ್ಕೋಬೇಕು. ಅದನ್ನೆಲ್ಲ ಸ್ವಲ್ಪ ಅವ್ರಿಗೆ ಹೇಳಿ, ಸೊ ದಟ್ ಏನು ಅಷ್ಟು ವರಿ ಮಾಡ್ಕೊಳ್ಳೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ ಅಂತ. ಆಮೇಲೆ ಇಫ್ ಪಾಸಿಬಲ್ ಆ ಕಿವಿಗೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕೊಳ್ಳೋ ಸಾಧ್ಯತೆ ಇದ್ದರೆ ಅಥವಾ ಹಾಕಿಸ್ಬೇಕು ಅಂತಿದ್ರೆ, ಬಟ್ ಒಂದು ಕಡೆ ಚೆನ್ನಾಗಿದ್ರೆ ಅವ್ರಿಗೆ ಬೇಕು ಅನ್ಸೋದಿಲ್ಲ. ಬಟ್ ಈ ಸೌಂಡನ್ನ ಕಡಿಮೆ ಮಾಡಬೇಕು ಅಂದರೆ ಆ ಕಡೆ ಸೈಡ್ ಹಿಯರಿಂಗ್ ಏಡ್ಸ್ ಹಾಕ್ಕೊಂಡ್ರೆ ಅದು ಒಂದು ರೀತಿಯಲ್ಲಿ ಅವ್ರಿಗೆ ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ, ಅದೊಂದು. ಆಮೇಲೆ ಈಗ ಸೈಲೆಂಟಾಗಿ ಅವರು ಮನೇಲಿ ಒಬ್ಬರೇ ಇದ್ದಾರೆ, ಸ್ವಲ್ಪ ಏನಾದ್ರು ಸೌಂಡ್ ಬರ್ತಿದೆ, ಆಗೇನಾದರೂ ನಾನು ಆಗಲೇ ಹೇಳ್ದಂಗೆ ಒಂದು ಬ್ಯಾಕ್ಗ್ರೌಂಡಲ್ಲಿ ಏನಾದರೂ ಒಂದು ಸೌಂಡ್ ಹಾಕೋಬೋದು. ಅದೇನಾದ್ರು FM ಮ್ಯೂಸಿಕ್ ಇರ್ಬೋದು ಅಥವಾ ಯೂಟ್ಯೂಬಲ್ಲಿ ಏನಾದರೂ ಸಾಂಗ್ಸ್ ಇರ್ಬೋದು, ಅಥವಾ ಅವ್ರಿಗೆ ಏನು ಖುಷಿ ಕೊಡುತ್ತೋ ಅಂಥದ್ದು ಯಾವುದಾದ್ರೂ ಒಂದು ಬ್ಯಾಕ್ಗ್ರೌಂಡಲ್ಲಿ ಹಾಕ್ಕೊಂಡಿದ್ದಾಗ ಏನಾಗುತ್ತೆ ಅದ್ರ ಕಡೆ ಕೊಡೋಂಥ ಗಮನ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಸೊ ಯೂಶಲಿ ಏನು ಮೇಜರ್ ಪ್ರಾಬ್ಲಮ್ ಇರಲಿಕ್ಕಿಲ್ಲ, ಬಟ್ ಬೇಕಿದ್ರೆ ಒಂದ್ಸಲ ಬಂದು ಸುಮಾರು ಯೂಶಲಿ ಏಜ್ ಆಗಿದ್ದರೆ ಇಯರ್ಲಿ ಒಂದ್ಸಲ ಕಿವಿ ಟೆಸ್ಟ್ ಮಾಡಿಸೋದು ಯಾವತ್ತೂ ಉತ್ತಮ. ಬಂದಬೇಕಾದ್ರೆ ಒಂದ್ಸಲ ಟೆಸ್ಟ್ ಮಾಡ್ಬೋದು, ಬಟ್ ಜನರಲಿ ಏನು ಮೇಜರ್ ತೊಂದರೆ ಇರೋದಿಲ್ಲ.
ಓಕೆ ಸರ್, ಇದು ಏನಾದರೂ ಕಡಿಮೆ ಮಾಡ್ಬೋದಾ ಸರ್? ಅಂದರೆ ಸುಮ್ಮನೆ ಹಂಗೇನೆ ಫುಡ್ ಇಲ್ಲ ಇದು ಏನು ಬರ್ಬೋದು ಆ್ಯಕ್ಚುಲಿ ಇದು? ಅದೇ ಕಡಿಮೆ ಮಾಡ್ಬೋದು. ಅಂದರೆ ಈಗ ಅವ್ರಿಗೆ ಏನೂ ಅದಕ್ಕೆ ಥೆರಪಿ ತಗೋತಾ ಇಲ್ಲ, ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕೊಂಡು ಇಲ್ದಿರೋದ್ರಿಂದ ಅವ್ರಿಗೆ ಜಾಸ್ತಿ ತೊಂದರೆ ಆಗ್ತಿದೆ. ಸೊ ಒಂದ್ಸಲ ಪುನಃ ಡೀಟೇಲಾಗಿ ಎವ್ಯಾಲ್ಯೂಷನ್ ಮಾಡಿಬಿಟ್ಟು ಒಂದ್ಸಲ ಅವ್ರಿಗೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಅವಶ್ಯಕತೆ ಇದ್ದರೆ ನಾವು ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕಿ ನೋಡ್ಬೋದು. ಅದರಿಂದನೂ ಸ್ವಲ್ಪ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಎಲ್ರಿಗೂ ಬರುತ್ತೆ ಇಲ್ಲ ಕೆಲವ್ರಿಗೆ ಮಾತ್ರ ಸರ್? ಏನಕ್ಕೆ ಬರ್ಬೋದು ಸರ್?
ಅದೇ, ಇದು ಯಾಕೆ ಬರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಯಾರೇ ಹಿಯರಿಂಗ್ ಲಾಸ್ ಇದ್ರು, ಈಗ ಯಾರೇ ಒಬ್ಬ ವ್ಯಕ್ತಿಗೆ ಒಂದು ಕಿವಿ ತೊಂದರೆ ಬಂದಿದ್ರೆ ಏನಾಗುತ್ತೆ, ಆ ಸೌಂಡ್ ಕೇಳಿಸ್ತಿರೋದಿಲ್ವಲ್ಲ, ಆಗ ನಮ್ಮ ಬ್ರೈನ್ ಏನು ಮಾಡುತ್ತೆ, ಓಕೆ ಈ ಸೌಂಡ್ ಕೇಳಿಸ್ತಾ ಇಲ್ವಲ್ಲಪ್ಪ ಅಂತ ಅದೇ ಆ ಸೌಂಡನ್ನ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡುತ್ತೆ. ಅದೇನೇ ಬರೋಂಥದ್ದು. ಸೊ ಎಲ್ಲರಿಗೂ ಇದು ಬಂದೇ ಬರುತ್ತೆ. ಸೊ ಯಾವುದೇ ಒಂದು ಕಾರಣದಿಂದ ನಿಮಗೆ ಕಿವಿ ತೊಂದರೆ ಬಂದಿದ್ರೆ ಆ ಥರ ಕಿವಿಯಲ್ಲಿ ಗುಯ್ ಅನ್ನೋ ಶಬ್ದ ಬರೋದು ಅದು ಕಾಮನ್, ಅದು ಎಲ್ಲರಿಗೂ ಬಂದೇ ಬರುತ್ತೆ. ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಜಾಸ್ತಿ ಯೋಚನೆ ಮಾಡಿದ್ರೆ ಅಥವಾ ಅಯ್ಯೋ ನಂಗೆ ಬರ್ತಾನೆ ಇದೆಯಲ್ಲಪ್ಪ ಅಂದಾಗ ಅದು ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಅದ್ರ ಪಾಡ್ಗೆ ಅದಿರಲಿ, ಓಕೆ ಲಾಸ್ ಇರೋದ್ರಿಂದ ಬರ್ತಾ ಇದೆಯಲ್ಲಪ್ಪ, ಏನು ಪ್ರಾಬ್ಲಮ್ ಮಾಡೋದಿಲ್ಲ ಅಂತ ಯಾವಾಗ ಮನ್ಸಿಗೆ ಹಾಕ್ಕೊಂಡು ಆರಾಮಾಗಿರ್ತಾರೋ ಅವಾಗ ಏನಾಗುತ್ತೆ, ಅದರದ್ದು ಇಂಟೆನ್ಸಿಟಿ ಅಥವಾ ಅದ್ರ ಪ್ರಮಾಣ ಕಡಿಮೆ ಆಗ್ತಾ ಹೋಗುತ್ತೆ.
ಓಕೆ ಸರ್, ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಸರ್.
ಓಕೆ ಓಕೆ, ಧನ್ಯವಾದ.
ಓಕೆ ಬಾಯ್.
So we're discussing on the medications, how it will affect tinnitus.
Yeah, so continuing with that, so medications as such doesn't cause any hearing loss or tinnitus if it is taken for some other condition. But if medications is taken unprescribed, or if there are ototoxic medications, so that can affect or cause tinnitus. So, and in terms of management also, so many people say that there are some medicines, if you take it, tinnitus will go and all that. But there is no research evidence to say that taking medicines will stop tinnitus. But medicines can be used as a supplement. That is, they are wearing a hearing aid and they are taking sound therapy and all that. And along with that, if you take medicines, so that will have an effect. But medicines on their own does not cause, does not treat tinnitus. So in that way, there is, there is no management-related link between medications and the tinnitus sound that they get.
So we know that what we eat and how we live will impact various health conditions. So can even diet and our life choices be influencing tinnitus also?
Yes, so definitely lifestyle changes and diet will have an effect on the tinnitus. Okay, so the things like, there are literature evidence which shows that person who has habit of smoking and alcohol consumption, so all of them have a risk of developing tinnitus, because that will have an effect on the hearing abilities. If the hearing abilities go down, so that will start getting tinnitus. So that is one thing. And all of us are now going to concerts or parties with loud noise and all that. So after that, the person has a chance of getting exposed to the tinnitus as well. And and stress is another aspect, because all of us are working with a lot of pressure and all that. So that is another thing that can aggravate tinnitus, or if tinnitus is there, that can make even more worse. And people who do not do exercises, who have a sedentary lifestyle, so they are more prone for risk. But if somebody who is active, has active lifestyle, and he does a lot of things like yoga, meditation to keep himself calm and less stress, so they will have a lesser issues with tinnitus.
Hello? Hello?
ಹಲೋ, ನಮಸ್ತೆ ಮೇಡಮ್.
ಹೇಳಿ ಮ್ಯಾಮ್, ನಮಸ್ತೆ. So, as we have already discussed how hearing loss can cause tinnitus, we have also heard the term about somatosensory tinnitus. How is it different from the regular tinnitus which is caused because of hearing loss?
Okay, so there is a concept called as somatosensory tinnitus. So what exactly it is any movement of the body part, so that leads to tinnitus, or that causes tinnitus. So for example, there are people who will complain that when I turn my head like this, or when I move up, or when I bend down, the tinnitus increases, or and sometimes when I turn my neck like this, the tinnitus completely stops and it doesn't come. So there are people who say that as well. So any movement of the body, so that leading to tinnitus. Another common complaint is like whenever after this call.
Hello? Hello? ಹಲೋ,
ಹಲೋ, ನಮಸ್ತೆ ಮೇಡಮ್.
ಹಾಂ ನಮಸ್ತೆ ಮ್ಯಾಮ್, ಕೇಳಿ, ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಕೇಳಿ.
ಮೇಡಮ್, ಏನಿಲ್ಲ, ನಮ್ಮ ಕೊಲೀಗ್ಸ್ ಒಬ್ರು ಕಿವಿಯಲ್ಲಿ ಆ ಥರ ಸೌಂಡ್ ಬರ್ತಾ ಇರುತ್ತೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ರು. ಮತ್ತೆ ಏನಂತಂದ್ರೆ ಈ ಥರ ಪ್ರಾಬ್ಲಮ್ಸ್ ಹೆಡ್ಫೋನ್ಸ್ ಹಾಕೊಳ್ಳೋದ್ರಿಂದ ಏನಾದರೂ ಬರುತ್ತಾ, ಅಥವಾ ಬ್ಲೂಟೂತ್ ಏನಾದರೂ ಹಾಕೊಳ್ಳೋದ್ರಿಂದ ಬರುತ್ತಾ, ಆ ಥರ ಸೌಂಡ್ ಬರ್ದೇ ಇರೋದಕ್ಕೆ ಏನು ಮಾಡಬೇಕು ಅಂತ ಮೇಡಮ್.
ಓಕೆ, ಸೊ ಅವರು ಈಗ ಹೆಡ್ಫೋನ್ಸ್ ಎಷ್ಟೊತ್ತು ಯೂಸ್ ಮಾಡ್ತಾರೆ, ಅಥವಾ ಏನು ವರ್ಕ್ ಮಾಡ್ತಾರೆ ಅವರು?
ಆಫೀಸಲ್ಲಿ FD ಆಗಿ ವರ್ಕ್ ಮಾಡ್ತಾರೆ.
ಓಕೆ ಓಕೆ, ಸೊ ಹೆಡ್ಫೋನ್ ರೆಗ್ಯುಲರ್ ಆಗಿ ಯೂಸ್ ಮಾಡ್ತಾರಾ ಅಥವಾ ಹೇಗೆ?
ರೆಗ್ಯುಲರ್ ಆಗಿ ಯೂಸ್ ಮಾಡಲ್ಲ ಸರ್, ಅವಾಗ ಯೂಸ್ ಮಾಡ್ತಾರೆ ಅಷ್ಟೇ.
ಅವಾಗ ಓಕೆ. ಸೊ ಹೆಡ್ಫೋನ್ ಯೂಸೇಜ್ ಅಥವಾ ಈಗ ಬ್ಲೂಟೂತ್ ಹೆಡ್ಫೋನ್ಸ್ ಯೂಸೇಜಿಂದ ಟಿನೈಟಸ್ ಹೆಂಗೆ ಬರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅದು ತುಂಬ ಲೌಡ್ ಸೌಂಡಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ರೆ ಮತ್ತು ರೆಗ್ಯುಲರ್ ಆಗಿ ಕಂಟಿನ್ಯೂಸ್ ಆಗಿ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಹೊತ್ತು ಯೂಸ್ ಮಾಡ್ತಾರೆ. ಯಾಕಂದರೆ ಕಾಲ್ ಸೆಂಟ್ರಲ್ಲಿ ವರ್ಕ್ ಮಾಡೋರು ಇರ್ಬೋದು ಅಥವಾ ಕಾನ್ಸ್ಟೆಂಟ್ ಆಗಿ ಕಿವಿಯಲ್ಲೇ ಯೂಸ್ ಮಾಡೋಂಥವ್ರಿಗೆ ಆ ಥರ ಬರೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಸೊ ಬಟ್ ಅಕೇಶ್ನಲ್ ಆಗಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಬಟ್ ಕಡಿಮೆ ವಾಲ್ಯೂಮಲ್ಲಿ ಕೇಳ್ತೀವಿ, ಜಾಸ್ತಿ ಹೊತ್ತು ಕೇಳಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಅದು ನಮ್ಮ ಕಿವಿಗೆ ಯಾವುದೇ ರೀತಿಯಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಮಾಡೋದಿಲ್ಲ, ಅದರಿಂದ ಯಾವುದೋ ಸೌಂಡ್ ಬರೋಕ್ಕೆ ಚಾನ್ಸ್ ಇಲ್ಲ. ಸೊ ಅವ್ರಿಗೆ ಟಿನೈಟಸ್ ಬರ್ತಿದೆ ಅಂದರೆ ಅದು ಬೇರೆ ರೀಸನ್ನಿಂದ ಇರ್ಬೋದು. ಅಂದರೆ ಮೇ ಬಿ ಅವ್ರಿಗೆ ಹಿಯರಿಂಗ್ ರಿಲೇಟೆಡ್ ಏನಾದ್ರು ಇಶ್ಯೂಸ್ ಇರ್ಬೋದು, ಅಥವಾ ಹೇಗೆ ಸ್ಟಾರ್ಟ್ ಆಯಿತು ಅದೆಲ್ಲ ಸ್ವಲ್ಪ ಡೀಟೇಲಾಗಿ ನೋಡಬೇಕಾಗತ್ತೆ. ಅದಕ್ಕೆ ತಿಳ್ಕೊಂಡು ಯಾವ ಕಾರಣದಿಂದ ಬರ್ತಾ ಇದೆ ಅಂತ ನಾವು ಅದನ್ನು ಹೇಳ್ಬೋದು. ಓಕೆ, so I was explaining about somatosensory tinnitus. What is that? Is because of any movement of the body, so that leads to tinnitus. So another reason is if they have any problem in their jaw muscles. Okay, so it's like we call it as, this joint is called as a temporomandibular joint. If because of some issues they are not able to open their mouth widely, or they have got a dental work, maybe because their mouth was open for a long time, or they have their bite issues and all that. So what happens is there is a connection from the somatosensory network. What I mean by somatosensory network is the body network, that is your head, neck muscles, all this. So they are connected to the hearing system. So any pain that is there in the jaw, maybe the pain that is there in the neck, can send nerve impulses to the auditory system as well. So the person can actually hear that sound as tinnitus. So generally what is a complaint is a person will come up with, whenever I get neck pain, the tinnitus will become more. So that is a common complaint that they say. And whenever I turn my head this side, it stops, and sometimes it will increase. So this is what we call it as somatosensory tinnitus. And people who do a lot of desk job where there is very less movement of the head, so they don't move a lot, so they are the ones who are more prone or more at risk for getting this somatosensory tinnitus. So if somebody has this somatosensory tinnitus, the way that we need to approach, okay, so I'll tell about the management.
Hello. ಹೇಳಿ ಮ್ಯಾಮ್.
ಹಾಂ, ನಾನು ಟಿನೈಟಸ್ ಬಗ್ಗೆ ಮಾತಾಡಬೇಕಿತ್ತು ನಿಮ್ಮ ಹತ್ರ.
ಕೇಳಿ, ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಕೇಳಿ.
ನನಗೆ ಕಿವಿಯಲ್ಲಿ ತುಂಬ ಕೀ ಅಂತ ಸೌಂಡ್ ಕೇಳ್ತಾ ಇರುತ್ತೆ, ತುಂಬ ಡಿಸ್ಟರ್ಬ್ ಆಗ್ತದೆ.
ಓಕೆ.
ನಾನು ಕೆಲಸದಲ್ಲಿ ಇರುವಾಗ ಅಷ್ಟೊಂದು ನನಗೆ ಇದಾಗೋದಿಲ್ಲ. ಒಬ್ಬಳೆ ಮನೆಯಲ್ಲಿರುವಾಗ ನನಗೆ ತುಂಬ ತೊಂದರೆ ಆಗ್ತದೆ.
ಓಕೆ. ಯಾವ ಕಡೆ ಶಬ್ದ ಕೇಳುತ್ತೆ ನಿಮ್ಗೆ? ಎರಡು ಕಡೆನಾ ಅಥವಾ ಒಂದು ಕಡೆನಾ? ಎಡಗಡೆ ಮಾತ್ರ. ಓಕೆ. ಯಾವಾಗಿಂದ ಥರ ಕೇಳ್ತಾ ಇದೆ?
ಒಂದು 2-3 ತಿಂಗಳೇ ಆಯಿತು.
ಹೇಗೆ ಸ್ಟಾರ್ಟ್ ಆಯಿತು? ಏನಕ್ಕೆ ಈ ಥರ ಸೌಂಡ್ ಬರೋಕ್ಕಾಯ್ತು ನಿಮ್ಮ ಅನಿಸಿಕೆ ಪ್ರಕಾರ?
ನನಗೇನು ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ.
ಓಕೆ, ಬಟ್ ಶಬ್ದ ಬರ್ತಾ ಇದೆ. ಓಕೆ.
ಸೌಂಡ್ ಬರುತ್ತೆ.
ಓಕೆ. ಅದು ನೀವು ಕಿವಿದೇನಾದರೂ ಟೆಸ್ಟ್ ಏನಾದರೂ ಮಾಡಿಸಿದ್ರೆ ಯಾವಾಗಾದರೂ ಕೇಳಿಸ್ಕೊಳ್ಳಿ, ನಿಮಗೇನಾದ್ರು ಅನಿಸುತ್ತಾ ಕೇಳಿಸ್ಕೊಳ್ಳೋದೇನಾದರೂ ಕಡಿಮೆ ಆಗಿದೆ ಆ ಕಡೆಗೆ ಮತ್ತು ಈ ಕಡೆ? ಕೇಳಿಸ್ಕೊಳ್ಳುತ್ತೆ. ಓಕೆ. ಆಮೇಲೆ ಏನಾದರೂ ಕತ್ತನ ಆ ಕಡೆ ಈ ಕಡೆ ಮಾಡಿದ್ರೆ ಶಬ್ದ ಕಡಿಮೆ ಆಗೋದು ಆ ಥರ ಏನಾದರೂ ಅನಿಸುತ್ತಾ? ಯಾವ ಥರ ಶಬ್ದ ಬರುತ್ತೆ? ಅದು ಕುಯ್ ಅನ್ನುತ್ತಾ ಅಥವಾ ಕುಯ್ 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 ಅನ್ನುತ್ತೆ? ಓಕೆ. 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 ಸೊ ಅದೇನೆ, ಈಗ ಕಿವಿಯಲ್ಲಿ ಈ ಥರ ಗುಯ್ ಅಂತ ಶಬ್ದ ಬರಲಿಕ್ಕೆ ಬಹಳಷ್ಟು ರೀಸನ್ನಿಂದ ಬರ್ಬೋದು. ಸೊ ಅದನ್ನು ನಾವು ಡೀಟೇಲಾಗಿ ಇವ್ಯಾಲ್ಯೂಯೇಷನ್ ಮಾಡಿ ಅದಕ್ಕೆ ಟ್ರೀಟ್ಮೆಂಟ್ನ ಕೊಡ್ಬೋದು. ಮೆಜಾರಿಟಿ ಆಫ್ ದ ಕೇಸಸ್ ಈ ಥರ ತೊಂದರೆ ಇರೋರನ್ನ ಅದನ್ನು ಟ್ರೀಟು ಸಹ ಮಾಡ್ಬೋದು. ಸೊ ನಿಮಗೆ ಈಗ ಕೇಳಿಸ್ಕೊಳ್ಳೋ ಸಮಸ್ಯೆ ಏನೂ ಇಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಒಂದ್ಸಲ ಏನು ಮಾಡ್ತೀವಿ ಅಂದರೆ ಡೈರೆಕ್ಟಾಗಿ ನಮಗೆ ಗೊತ್ತಾಗ್ತೇನೂ ಇರೋದಿಲ್ಲ. ಸೊ ಒಂದ್ಸಲ ನಾವು ಒಂದು ಆಡಿಯೋಲಾಜಿಕಲ್ ಇವ್ಯಾಲ್ಯೂಯೇಷನ್ ಅಂತ ಮಾಡ್ತೀವಿ. ಸೊ ಮಾಡಿ ಯಾವ ಥರ ತೊಂದರೆ ಇದೆ, ಎಲ್ಲಿ ಏನಾದರೂ ಕೇಳಿಸ್ಕೊಳ್ಳೋ ಪಾತ್ವೇಲಿ ಏನಾದರೂ ತೊಂದರೆ ಇದೆಯಾ ಅಂತ ಒಮ್ಮೆ ಪರೀಕ್ಷೆ ಮಾಡಿ ನೋಡ್ಬೋದು. ಅದನ್ನು ನೋಡಿಬಿಟ್ಟು ಅದಾದಮೇಲೆ ಅದಕ್ಕೆ ತಕ್ಕಂಗೆ ಏನು ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ನೀವೊಬ್ಬರು ನೀವು ಮೈಸೂರಿಗೆ ಹತ್ತಿರ ಇದ್ದರೆ ಇಲ್ಲೇ ಬಂದು ತೋರಿಸ್ಬೋದು. ಇಲ್ಲೂ ನಾವು ಟಿನೈಟಸ್ ಬಗ್ಗೆ ಅದನ್ನು ಏನು ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳ್ತೀವಿ. ಇಲ್ಲಾಂದರೆ ಯಾರು ಇದ್ರ ಬಗ್ಗೆ ಚೆನ್ನಾಗಿ ನೋಡುವಂಥ ಯಾರು ಆಡಿಯಾಲಜಿಸ್ಟ್ನ ಹತ್ರ ತೋರಿಸ್ಬೋದು. ಈವನ್ ಏನಂದರೆ ಇದು ಸಿಂಪಲ್ ಫಸ್ಟ್ ಗುಗ್ಗೆ ಇದ್ರೂ ಸಹ ಬರ್ಬೋದು, ಅಥವಾ ಕಿವಿಯಲ್ಲಿ ಏನಾದರೂ ಸ್ಲೈಟಾಗಿ ಇನ್ಫೆಕ್ಷನ್ ಆಗಿದ್ರೂ ಸಹ ಬರ್ಬೋದು, ಅಥವಾ ಏಜ್ ರಿಲೇಟೆಡ್ ಏನಾದ್ರು ಇಶ್ಯೂಸ್ ಇರ್ಬೋದು, ಅದು ಏನು ಬೇಕಾದರೂ ಆಗಿರ್ಬೋದು. ಸೊ ಯಾವುದೇ ಕಾರಣದಿಂದ ಬರೋ ಚಾನ್ಸ್ ಇದೆ. ಬಟ್ ಏನು ಕಾರಣ ಅಂತ ನಾವು ಐಡೆಂಟಿಫೈ ಮಾಡಿದ್ಮೇಲೆ ಅದಕ್ಕೆ ತಕ್ಕಂಥ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟರೆ 100% ಅದು ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ. ಏನು ವರಿ ಮಾಡ್ಕೊಳ್ಳೋಂಥದ್ದು ಏನಿಲ್ಲ. ಸೊ ಇದೇನು ಒಂದು ದೊಡ್ಡ ಸಮಸ್ಯೆ ಅಂತ ಮನಸ್ಸಿಗೆ ಹಾಕೊಳ್ಳೋಕೆ ಹೋಗಬೇಡಿ. ಬಟ್ ಇದು ಜಸ್ಟ್ ಬರಬೇಕಾದ್ರೆ ಇರಿಟೇಟ್ ಆಗುತ್ತೆ, ಯಾಕಂದರೆ ಕಾನ್ಸ್ಟೆಂಟಾಗಿ ಅದು ಸೌಂಡ್ ಬರ್ತಿದೆಯಲ್ಲ, ಅಂದರೆ ನೀವೇ ಹೇಳ್ದಂಗೆ ಕಾನ್ಸಂಟ್ರೇಷನ್ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ, ಇರಿಟೇಷನ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಆ ಟೈಮಲ್ಲಿ ಈಗ ನೀವು ಸದ್ಯಕ್ಕೆ ನೀವು ಮನೆಯಲ್ಲೇ ಏನು ಮಾಡ್ಬೋದು ಅಂತದಂದರೆ, ಏನಾದರೂ ನೀವು ಸೈಲೆಂಟಲ್ಲೆಲ್ಲ ಇದ್ದಾಗ ಯಾವ್ದಾದ್ರು ಒಂದು ಬ್ಯಾಕ್ಗ್ರೌಂಡಲ್ಲಿ ಏನಾದರೂ ಒಂದು ಮ್ಯೂಸಿಕ್ ಹಾಕೊಳ್ಳೋ ಮುಖಾಂತರನೋ, ಅಥವಾ ಏನಾದರೂ ಒಂದು ಸೌಂಡ್ ಇದ್ದಾಗ ಏನಾಗುತ್ತೆ, ನಿಮ್ಮ ಗಮನ ಇದ್ರ ಕಡೆ ಅಷ್ಟೊಂದು ಹೋಗೋದಿಲ್ಲ. ಆ ಥರ ಈಗ ಸದ್ಯಕ್ಕೆ ಮಾಡ್ಬೋದು. ಬಟ್ ನಾನು ಸಜೆಸ್ಟ್ ಮಾಡೋದೇನೆಂದರೆ, ಯಾವ್ದಾದ್ರು ಒಂದು ಆಡಿಯಾಲಜಿಸ್ಟ್ ಹತ್ರ ಅಥವಾ ENT ಡಾಕ್ಟರ್ ಹತ್ರ ಮೊದಲು ತೋರಿಸಿ ಏನಾದರೂ ತೊಂದರೆ ಇದೆಯಾ ಅಂತ ಫಸ್ಟ್ ಕ್ಲಿಯರ್ ಮಾಡಿಕೊಂಡು, ಅದೇನು ತೊಂದರೆ ಇಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಅದಕ್ಕೆ ತಕ್ಕಂಥ ಟ್ರೀಟ್ಮೆಂಟ್ಗಳ ಆಪ್ಷನ್ಸ್ ಅವೈಲೇಬಲ್ ಇದೆ. ಅದನ್ನು ಮಾಡಿದ್ರೆ ನಿಮಗೆ ಖಂಡಿತ ರಿಲೀಫ್ ಸಿಗುತ್ತೆ.
ನನಗೆ ಇಲ್ಲಿ ಆಯುಷ್ಗೆ ಬರ್ಲಿಕ್ಕೆ ತುಂಬಾ ಹತ್ರ ಇದೆ.
ಹಾಂ ಹಾಂ,
ನಾನು ಆಯುಷ್ ಹಿಂದ್ಗಡೆನೆ ಮನೆ ಇರೋದು ನಂದು.
ಓಕೆ ಓಕೆ.
ನಾನು ಯಾವಾಗ ಬರ್ಬೋದು?
ಅದೇ ನೀವು ಒಂದು ಈಗ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತಗೊಂಡು ನೀವು ಆನ್ಲೈನ್ ಅಪಾಯಿಂಟ್ಮೆಂಟು ಸಹ ತೊಗೋಬೋದು, ಅಥವಾ ನೀವು ಬೆಳಗ್ಗೆ ನಾವು ಸೋಮವಾರದಿಂದ ಶುಕ್ರವಾರ ಓಪನ್ ಇರುತ್ತೆ. ಸೊ ನೀವು ಬೆಳಗ್ಗೆ 9 ಗಂಟೆ ಅಷ್ಟೊತ್ತಿಗೆ ಬಂದರೆ ನಾವು ಇಲ್ಲಿ ಡೀಟೇಲಾಗಿ ಚೆಕ್ ಮಾಡ್ತೀವಿ. ಮತ್ತು ಇದು ಟಿನೈಟಸ್ಗೋಸ್ಕರ ಅಂತಲೇ ನಮ್ಮದೊಂದು ಸೆಂಟರ್ ಇದೆ, ಅಲ್ಲಿಗೆ ನಮ್ಮನ್ನ ರೆಫರ್ ಮಾಡಲಾಗುತ್ತೆ. ಸೊ ಅಲ್ಲಿ ನಾವು ರಿಸಲ್ಟ್ಸ್ನೆಲ್ಲ ನೋಡಿ, ಅಥವಾ ಇನ್ನೇನಾದ್ರು ಟೆಸ್ಟ್ ಅವಶ್ಯಕತೆ ಇದೆಯಾ ಅಂತ ತಿಳ್ಕೊಂಡು ಅದಕ್ಕೆ ತಕ್ಕಂಗೆ ನಿಮಗೆ ಗೈಡೆನ್ಸ್ನ ಕೊಡ್ತೀವಿ. ಯಾವ ರೀತಿ ಮಾಡಬೇಕು, ಏನು ಮಾಡಬೇಕು, ಥೆರಪಿ ಅವಶ್ಯಕತೆ ಇದೆಯಾ, ಅಥವಾ ಸೌಂಡ್ ಥೆರಪಿ ಅಂತ ಕೊಡ್ತೀವಿ, ಅದನ್ನು ಯಾವ ರೀತಿ ಮಾಡಬೇಕು ಅನ್ನೋಂಥ ಸಂಪೂರ್ಣವಾದ ಗೈಡ್ಲೈನ್ಸ್ನ ನಿಮಗೆ ಕೊಡ್ತೀವಿ ನಾವು. ಸೊ ಬಂದೊಮ್ಮೆ ತೋರಿಸಿ ಮ್ಯಾಮ್.
ಆಯ್ತು, ಥ್ಯಾಂಕ್ ಯು ಸರ್.
So I was explaining about somatosensory. Just to complete that, in terms of management, if a person has pain and everything, we should refer them for a physiotherapy management as well. So where this neck muscles and all that relief would be done by a physiotherapist, and the sound therapy part that I was telling, so that can be done by an audiologist as well together. So once both the therapies are done together, so that will help an individual, in managing the somatosensory tinnitus in a better way. So now the prevalence of somatosensory tinnitus is increasing because of, again, the lifestyle changes and more desk work that they are doing, and along with the stress and all that. So but this is something which can be treated easily. So once the neck pain and everything, or a jaw pain, we'll refer them to a dentist, and they clear all that EMJ and everything. So that gives them an instant relief from their tinnitus.
Sir, is objective tinnitus similar to somatosensory tinnitus, or how is it different, and what can be the causes for these objective tinnitus?
Yeah. So there's another condition called as objective tinnitus, which is slightly rare. But what is this objective tinnitus is, we call it as two types. One is subjective and objective. So subjective means the patient alone is hearing the tinnitus. Only the person suffering is hearing the tinnitus. But objective is, as a clinician or as a doctor, I can also hear the tinnitus. So that's what is objective. Somebody is person sitting next to them can also hear a continuous sound, and that's what we call it as objective tinnitus. Most often objective tinnitus is because of a vascular problem. Vascular, I mean there's a problem in the blood vessel, because the blood supply is not properly going to the ear. So that abnormal blood flow is something that we hear it as tinnitus. And also if there is abnormal muscle movement, that also is something that we hear it as tinnitus. So objective tinnitus is a medical condition. So what we recommend is to get an MRI done to confirm whether is there any lesion in the brain, or we also do something called as angiography or a Doppler test to confirm whether the blood vessels in the neck area and the ear area are fine and working properly or not. So based on that, appropriate medical management can be done. So this is something that can be again treated with appropriate medical intervention. This objective tinnitus is something that can be cured and treated.
So now we got to know that tinnitus is a common condition. It affects many people. Is there a cure? Like, what are the management options that are available based on the type of tinnitus?
Yeah. So it depends. The cure for tinnitus or the management of tinnitus depends on the cause. So for example, as we have been talking, if the problem is in the outer ear on the middle ear, if there is a wax or if there is infection and things like that, once that gets resolved, automatically the tinnitus will also stop. So those are treatable conditions. So I told you about somatosensory and objective, that if a medical intervention is done or if a physiotherapist or a dentist work is properly done, so then that can also be treated. But another people with sensory neural hearing loss or people who have problem in the inner ear, and because of that they are hearing the tinnitus, what is the treatment? We give a hearing aid and everything. Along with that, they have to take something called as a therapy. So therapy is where we will teach them on ways that they can use to manage the tinnitus. So now they're constantly paying attention to the tinnitus. So sound is always there. But what we will do is, in therapy, we will tell them techniques or we will teach them techniques where even if they are hearing the tinnitus, the body will filter that out, or your brain will filter that out and it won't pay attention to it. So for example, if imagine you're in your house and there is a fan running, fan is making the sound, but unless somebody says that fan is making the sound, we won't pay attention to it. We are hearing the fan sound, but we are able to do our daily activities regularly even without noticing that fan is making sound. So why? Because we know that fan makes sounds and it is not something dangerous or something to be worried about. So that's what we will do in tinnitus therapy, where we will be teaching them with techniques or methods where even if the sound is coming, the brain won't pay attention to it. So why does the brain doesn't pay? We'll teach the methods where sound is not dangerous. To that level, we say something called as habituation or getting used to the sound. So there are tried and tested techniques that we will teach them when we do sound therapy or a tinnitus retraining therapy, where we are retraining the brain to unlearn what it has learned. So in that way, appropriate therapy can be given. So additionally, there is something called as cognitive behavioral therapy, and there are additional methods that we can do for more severe patients who have more psychological issues and all that. So all that can also be done, which can help people with tinnitus. So right now, we should not worry that there is, even if you Google, it will say no cure for tinnitus. But the issue is there are some types of tinnitus which can be cured, and there are other types of tinnitus where we can, help them manage the tinnitus, where they are not getting bothered by the tinnitus. They are able to live their life that they want to live even with tinnitus. So that is available, and that is like the cure for the tinnitus. So that options or that management strategies are available as of now.
So as you mentioned in the beginning that most of us would have experienced tinnitus at some point or the other. So how do we know that when do we have to seek professional help? When do we have to get it treated? How do we know about it?
Yeah, so generally if a person hears tinnitus, it will be for few seconds or for few minutes, for example, but there are some situations where it can last for few days as well. Imagine I've gone to a loud concert and I have a temporary hearing loss and I hear the tinnitus for few days. So if the tinnitus lasts for at least more than 3 to 4 days and it is not reducing, so we should not panic. We should immediately go to a ENT doctor, or we have to go to an audiologist, so where they will do a thorough examination of why exactly is the issue or what exactly is the problem, and appropriate guidance would be given. So in tinnitus can be a simple condition and also can be a serious condition as well. So depending upon the problem that is causing it, an appropriate management can be done. So generally we would wait for couple of days where the tinnitus should automatically stop and you should not worry about it. But even if it is still continuing, it is better that you get a evaluation done, because earlier it is always the better, because we wouldn't have gotten that strong emotional connection. So if it is early, when early itself we will get to know that tinnitus is not harmful or not dangerous, so that will help them overcome the tinnitus. So as early as possible, if you consult an ENT doctor or an audiologist, so that will really help them.
Are there any recent advances or research going on in this area for the management of tinnitus other than the hearing aids or the how to avoid all those sounds?
Yeah, so there has been a lot of research that has been happening with respect to tinnitus, because there are so many people suffering from it, and tinnitus is considered to be a a global issue or a global burden, and a lot of new technology has been coming where they are trying to find a cure for tinnitus. So that has been happening. So there has been research from a genetics angle where gene therapy is another area that they are looking at in terms of management of tinnitus. So people are looking also in terms of pharmacological management. They are trying to find out drugs which can inhibit that extra neural activity that is happening. So work is happening in that line as well. So, and people have been working on something like we call it as neuromodulation. So what is that neuromodulation is? So in the brain there is extra activity. So what do? Is we put electrical current, or we can keep magnets where the activity can be reduced. So we give current or magnet to inhibit the activity or reduce the activity. So that is something that has been being researched. So there is a recent device called as bimodal stimulation, where the tongue is getting stimulated and along with that there is auditory stimulation that is happening. So both of them together is something that people are saying that will really help. So the whole mechanism is reducing the brain activities. If that is done, so that can help people overcome the tinnitus. So there has been a lot of research happening in those lines as well. So, and people have been doing fMRI studies to understand where exactly is the lesion, so where exactly is the problem, and trying to understand what is causing it, and then you provide appropriate neuromodulation methods for managing tinnitus. So these are some of the recent advances that have been happening with respect to tinnitus, and there's a lot of funding, a lot of research happening, and I'm sure in the near future we'll have something where we can say, rather than managing tinnitus, there is a cure for tinnitus as well. So right now there are lots of methods which can help us in managing the methods, okay, so and in terms of reducing the stress or using tinnitus retaining therapy or cognitive behavioral therapy. But recent advancement, there is a lot of research happening in these lines, and it is not far that we'll be able to find some accurate solutions for as a cure for tinnitus as well.
So as you mentioned about tinnitus retraining therapy and cognitive behavioral therapy, which kind of therapy should patient opt for based on their condition?
Yeah. So the therapy, which type to be used, so that depends on the patient. Okay, it basically depends upon the condition that the person has. So once a patient comes to us, we will do a detailed evaluation. There are a lot of questionnaires that we'll have to do, and a lot of measures that we will take depending upon whether they have additional psychological conditions, or depending upon whether they have these issues and all that. So we will decide what therapy is needed. So for majority of the patient, it would be the tinnitus retraining therapy that we'll start off with. But there are some patients in whom additionally a cognitive behavioral therapy is something that might also be necessary. Okay, so based on a patient who comes to our center, so we will do a thorough assessment in terms of questionnaires and everything, and after that we would be able to decide which one is beneficial. And if a person is going for a cognitive behavioral therapy, so the thing that is needed is, so the patient has to be ready to accept the tinnitus. So CBT works in the concept of let the sound be there, I'm okay to manage even with the tinnitus sound. So that is what is essential component for cognitive behavioral therapy. Okay, so if a patient is not ready for it, so then we'll have to go for a tinnitus retraining therapy only, because in tinnitus retraining therapy, we are giving masker sound where they're not hearing the sound for a while at least. But in CBT, we are not giving any masker sound. It is basically changing their thought process. Okay, if changing the thought process where they are changing the negative thoughts into more rational thoughts. So that will be totally decided by an audiologist who is providing the therapy, and also depends upon the patient's need. Okay, what patient wants and what he is ready for. Based on that, we would decide and provide appropriate management.
So before we wind up, what take-home message would you like to give to the audience?
Okay, so the take-home message that I would like to convey is basically, so tinnitus is not something that you should worry about. Okay, so tinnitus is something that can be cured in majority of the cases, and it can be managed successfully. So it is important that as soon as you start hearing the tinnitus, or if you suffering from it, So go to professionals who are managing tinnitus better. So you can visit our center, which is doing an excellent work in appropriate assessment and management of tinnitus. So consult an appropriate professional and get the necessary help. So this phone-in program was basically to make people aware what causes tinnitus and what are the management options available, and don't lose hope that there is no treatment or there is no cure. There is definitely a lot of options that we can help you with, so that you are able to overcome your tinnitus.
So, with this, we come to the end of this program. I extend my heartfelt gratitude to Dr. Prashant Prabhu for patiently answering all the questions and responding to all the queries. Audience, if you have any more queries regarding tinnitus or any other hearing related disorders, you can reach to us at our official website www.aishmysore.in and follow us on Facebook and YouTube AIISH page for more updates. Thank you.